We are back on Morning Line. Thanks for joining us on this Thursday. Nick Barris coming to you live. And this morning we're talking about Mental Health America of Mid-South. What does that mean? Translate for you. They work very hard to deal with mental health issues. Specifically this morning, the stigma associated with mental health and the treatments and the help that is out there among youngsters. And with us this morning, two guests. Dr. Desiree Kelly is with us, as well as Heather Smith. Desiree is the Public Health and Education Manager for the group, and Heather Smith is one of the Middle Tennessee coordinators. Thanks both for coming on. It's nice to see you. You both have such nice smiles. I like it when people smile at me. Hey, listen, we've got a few phone calls that waited through the break. If you don't mind, let's take a few of those, and you can. They may have a comment, they may have a question. We'll go to Ricky. Ricky, good morning. Hi, Ricky.
Good morning.
Good morning. What's on your mind?
If an adult has got mental problems and they go to a kid's doctor, they're supposed to go see an adult doctor, right? Not no kid doctor, for mental health.
Okay, maybe we can differentiate for that. I mean, the psychiatrist, there's some maybe, is there that big a difference in dealing with the depression in an adult than a child? And do you look for specific specialties when you seek out a physician or a psychiatrist or psychologist for that?
So there are definitely differences. One of the things I love about our organization is that we have, we serve as a referral service as well. We're not direct service, but if you ever had a question, you can call our number, and what we can do is connect you with the different psychiatrists, clinics that are in the area that might work with an adult or child, and then you can decide what's the best for you. But yes, they are two that exist, and usually you can talk to your medical doctor about what is available for you, and then they'll make a recommendation. And if they don't make a recommendation, yes, please feel free to call Mental Health America of the Mid-South, and we will provide you with some information that can help you.
And I guess I understand what you're saying. It certainly makes sense. Now, if you're dealing, say, just for instance, with an individual who's bipolar, whether a child or an adult, bipolar condition, you understand it. The reason you would maybe go to a different type of physician would be that they're dealing with different issues and the age and how you would deal with a child as opposed to an adult, correct?
Correct.
They have different pressures in their lives and issues along those lines. All right, let's go next to Ann. Ann, good morning. Hi, Ann.
Good morning. Unless you have worked or volunteered in a school, and I'm saying I've done that here in Davidson County, so that's what I'm basing this on. I think most people would be shocked at the guidance that guidance counselors actually give in the mental health field. Now, because of COVID, there is a push for school health nurses in all of our schools. Do you see that position being maintained next year and going forward? And do you see the mental health issues being able to better being served by those school nurses? Since most of our guidance counselors, based on what the board wants them doing, are paper pushers and are serving our students and getting them with better test scores and into colleges. And I hope that makes sense.
Okay.
That's a lot of questions,
yeah.
Ann. Let's try to unpack that.
Okay, you go for it. Thank you, Ann.
So I want to first say that at Mental Health America of the Mid-South, we offer a lot of different trainings. And so a lot of the counselors and the teachers come in for those trainings, those professional developments, and they are able to get QPR trainings, mental health first aid for youth, mental health first aid for adults. There are different trainings that they can use that can expand their knowledge. A lot of the counselors already know the information. These classes serve as reminders and refreshers and CEUs for these professionals. We work a lot with the counselors, and from our perspective, and I'll Heather chime in here in a minute, they are doing everything that we need for them to do on our end. They are seeing the crisis, they are notifying the proper people, and they are getting the child's help. Now, school health nurses, I feel the same way about them. Everybody has a role, everybody has a lane that they stay in. And if we collaborate and we work together, we can actually get the best services for whatever youth that is out there that is living with a mental illness that is diagnosed by a licensed clinician. Heather, do you have anything that?
Yeah, I would just echo what you're saying, but from my experience working with different counselors and prevention specialists from different counties in Tennessee, I've seen that they're very passionate about serving the youth that they work with and the kids that they work with, and providing not only education, but also being there to take questions and to really notice what's going on with these students and to be available. And so I can't speak for all counselors in all of the schools, but certainly the ones that we've had the privilege of working with have done a lot to support and create opportunities for kids to get the support that they need. And also, I definitely echo what Dr. Kelly was saying about the school nurses who have such an important role in not only recognizing symptoms that are physical, but also mental. And that's one of the examples that I can give is that we recently were in a youth mental health first aid training session, and one of the colleagues that we were participating with is actually working with school nurses in Tennessee to make sure that they receive that mental health first aid training. So it's definitely a priority for school nurses to be able to recognize those symptoms and help connect students to the help that they need, in addition to what's already being done by the counselors in the schools.
Okay.
And you also mentioned that, is this going to be a need after the pandemic? Once it's flat? Absolutely. Mental health is always a need. Mental health is just as important as physical health, right? Yep. So I need for that to be said and understood. Mental health will always be needed in schools because kids deal with so many different things, and we want to make sure we address it. And like Nick said earlier, it's not like when we were in school. There's so many other different layers and stressors that they deal with day to day. So mental health is always going to be needed. Mental health education, mental health sessions, mental health coping strategies. And that's one of the things that Mental Health America provides. And we are passionate about it.
Yeah, so. I'll tell you, and you're right. So much of what you do, I wish was there when I was in school. And I guess we should be clear on this, that I suppose, ETSI doesn't just deal with mental health issues for those who maybe have some type of clinical condition that's being diagnosed. I mean, I think hopefully you're dealing, like for instance, one of the topics for grades 6 to 12 I see on your description here is test anxiety. All right, well, here's a news flash. Most people are going to feel anxiety over a test. And that's normal. That doesn't mean you have to go to a doctor to talk to them about it. Now, some people are going to feel it worse than others, but just if I could have been given some guidelines not to stress out so much over a very important test, that might have helped me. That doesn't mean I felt I had any problem, okay? And so I'm just wondering at what point, you decide, test anxiety, you can help kids across the board. This just isn't for kids that maybe have special problems, if you know what I mean.
Agreed. So, and that's such a funny and interesting question. I'm so glad you brought that up because test anxiety is a big one, but it's big around TCAP.
Yeah.
And we can remember doing presentations to auditorium size crowds as well as classroom size. And what always fascinated me was that we had fifth graders coming up to us and say, I'm really stressed. My mom expects me to get into college. And we're saying, okay, let's give you some coping skills to deal with that. They said, I am literally losing my mind, Dr. Kelly. What do I do? So this is a real thing starting at fifth grade because they are getting pushed with so many different testing modules and they need coping skills. And so we are very excited about coming in and providing a presentation and let them talk to us candidly and have a conversation. And many of them know the information. Once we give the steps about breathing deep, taking a break, reminding yourself that you have done this before, so you can definitely do it again. Or if you need a moment, talk to your teacher ahead of time and say, you know what, I really do have moments of anxiety during tests. What can we do to help that? And then get your parent to help and y'all come up with an action plan. Some tests won't allow you to do that, but many of them will if you work that out with your teacher and your parent. But yes, that is a real big presentation.
Yeah, I can imagine. The issue there, you talked about teachers and parents, and I understand in schools, we were talking about counselors and the folks there that can be there to help kids work through this. Teachers, as you both know, have so much on their plate these days, and there can be times maybe a teacher is so busy, they're not able to observe something maybe they should catch. And you know as well as I do, there are more than a few kids out there that just have lousy parents that don't care and aren't involved in their lives. So it falls on the schools and hopefully the counselors to step in to assist. What about in situations like that? Because there, unfortunately, and I see it in the news business, there are a lot of people who simply should not be parents out there, and their poor children need the help, and it's almost as though they're going to have to be on their own to hopefully get some from school, which job one of the schools to educate, but now they're being asked also to help them deal with some of these serious mental issues. Well, someone's going to have to say something. Come on, jump in. Let's go.
Absolutely. I have so much, but I don't want to maximize the conversation.
Oh, that's all right. You go ahead, so, and then yes, Heather, you got to start talking. Okay, go ahead.
So let's back up for just a second. We give parents and teachers kudos because we feel very passionate about what we do. I love that term that Heather used, because at the end of the day, I kind of feel like so many things happen in the schools, and we give accolades to our teachers because they're amazing, right?
Yeah.
And they're normally the first adult in a child's life that sees that they're struggling. And so as parents, one of the things that we can do is that we can talk to the teacher and not have preconceived notions coming in. We can listen instead of attacking, because sometimes we're so mama bear, papa bear that we don't give the option for the teacher to explain what's going on.
Right.
And teachers are really just reporting and telling us. So when I go into different parent meetings or council meetings and they ask us, what can parents do? Well, I'm a parent too. I wear two different hats. I'm a mental health professional, but I'm also a parent. And so the first thing I do is I don't automatically assume that they're out to get my child.
Right.
What I do assume is that they're there to help. And now we can work together to help them with the many different things that they have. And one of the things I love about the Erase the Stigma program is that we educate children about their mental health and emotional well-being. And we try to teach children coping skills to manage their emotions in positive ways, right? So when we do this, we introduce this through I See Hope's program mascot. And I'm gonna let Heather talk a little bit more about that. But we actually see kids from 5th grade to 9th grade who see us in 9th grade and say, I remember I See Hope. I remember the duck. You're the duck lady. And we'll take it as long as you can remember the message. And the message has always been, advocate for your mental health. Let everybody know that's in your trusted circle that you're not okay when you're not okay. Don't sit on it. Don't be silent.
All right, Heather, do you have a duck? Do you have a duck you can show us?
I do. And I did want to just chime in with the question that you had, just to say that we definitely do know that some kids come from home situations that are definitely not ideal. I've been a case manager before and worked in a lot of situations where maybe it wasn't the parent taking care of a child, maybe it was a different relative or even somebody not necessarily related to that child. And so we are very careful when we have the trusted adult conversation with kids to help them recognize where are they getting support. So if they feel very close to a teacher at school and that's the person they trust the most, we emphasize that trusted adult does not simply mean mom and dad. It can also be other family members. And it's actually been proven that one of the most powerful protective factors for a child who might be facing risky circumstances in terms of developing a mental health disorder or those kinds of challenges can simply be having a different adult in their life, a trusted adult in their life, someone who they can go to, who checks in on them. And so we definitely emphasize not only looking out and asking and speaking up to your parents, but also recognizing who is the trusted adult in a child's life who they really do trust and feel comfortable with. And that can be found
before you move on, I do want to interject on that trusted adult. Nick, every time we go into elementary schools, we'll ask children, who are your trusted adults? And every time, without fail, they'll say mom, dad, and granny. We'll say, what about grandpa? And they'll be like, We'll be like, what is that? But the beauty of all of this is that they they can actually recognize who the trusted adult is, right?
Yeah.
And then they say who their trusted adults are in school. And that's one of the major parts of our program that we implement into schools and try to provide all this extra information and resources, is to know who your trusted adult is. And earlier you mentioned something about when they go to teachers might not be available. Well, we talk about that too. That's why we asked them to do identify 3 trusted adults, because that teacher might be busy, but if that's your trusted adult, you can best believe that teacher's going to circle back around the next 24 hours and say, what's going on? Because at the end of the day, we all are adults and we all have things that happen. Life happens, we're all dealing with different layers, particularly amidst of this pandemic. But I always encourage teachers, and our Heather and Patrice do a really good job as well as encouraging teachers to say, be the trusted adult, because we're asking students to nominate you, to identify you, to make you the trusted adult, to actually be that trusted adult for the kids. And we have seen remarkable things and heard wonderful stories. So I did want to throw that in.
I think that's awesome. Yeah, I'm thinking about it, and I've done stories before where sometimes that trusted adult turns out to be one of the school resource officers or SROs who are in the buildings. It could be an older sibling, it could be a neighbor. So listen, on that note, we'll take a quick break. When we come back, more of our conversation. When we do come back, I want to see the duck. She's not okay. We'll see the duck. It's Icy Hope. All right, we'll be back with more right after this.
This is a Storm 5